G'day everyone, my name is Philip Rosak and I'm going to present our work titled Detail Matters, High Frequency Content for Realistic Synthetic Brain MRI Generation. I would like to begin this presentation by acknowledging the traditional owners of the land that I'm presenting from, the Turrbal people, and pay my respect to their elders, past, present and emerging. In recent years, convolutional neural networks have been successfully applied in the field of medical imaging on segmentation and classification tasks. The quality of segmentation results largely depends on the training method, data, and in some cases corresponding labels used for segmentation model training. Supervised methods perform better than the other types of learning, but require a large training set with quality labels. Such labeled datasets are often publicly unavailable, especially in the field of medical imaging. Data augmentation methods are commonly used to enlarge training sets and improve segmentation results. Data augmentation methods can be roughly grouped as traditional, mixing, and synthetic. Traditional augmentation methods include techniques like scaling, rotation, flipping, and translation that provide limited variation improvements. Mixing augmentation methods, such as mix-up and its variants, gain popularity in classification applications due to the method's simplicity. Mixing augmentation methods have limited applicability on segmentation tasks with sometimes mixed results. Synthetic augmentation methods are capable of producing more diverse samples than traditional methods. Synthetic augmentation methods are commonly realized as generative adversarial networks, or so-called GANs. Conditional GANs are a variant of generative adversarial networks that provide more control over data generation. Still, there are certain challenges related to GAN-based 3D brain MRI synthesis, such as 3D shape and large image sizes, limited GPU memory, and working with batches and slices that introduce artifacts in the synthetic brain MRI scans. Synthetic brain MRIs commonly appear to be over-smoothed without fine detail as is shown in the figure. The appearance of synthetic MRIs can be explained as a manifestation of distribution mismatch between real and synthetic scans. That intuitively motivates the generation of realistic brain MRIs, but little is known about the direct benefits of fine detail on segmentation tasks. Therefore, we propose the GAN-based method for generation of 3D brain MRI scans with high-frequency detail. We further evaluated the effect of high-frequency detail on segmentation task performance. So how do we evaluate the effect of high-frequency detail on segmentation task performance? Firstly, we trained two generative GAN-based models, low-frequency and high-frequency GAN. Then we created two synthetic datasets, low-frequency and high-frequency brain MRI dataset, which we used for segmentation model training in combination with real MRIs. Finally, we compared the performance of segmentation models trained on real MRI scans to the performance of the models trained on mixed datasets. The method we propose can be split into two parts: the generation of PV maps that represent the anatomy of the novel synthetic subject, as shown on the A part of the figure, and the generation of synthetic MRIs with and without high-frequency detail from PV maps, as shown on the B part of the figure. To generate novel synthetic brain MRIs that correspond to the subject in between two real subjects, we use symmetric image normalization as a non-rigid registration method. By performing a non-rigid registration between two subjects, we obtain a half-way deformation field, which we use to warp the corresponding PV maps and obtain PV maps of a novel synthetic subject. The PV maps of synthetic subjects we use to generate both low-frequency and high-frequency synthetic MRIs, as shown on the B part of the figure. A conditional GAN-based solution was selected for the generation of more and less realistic synthetic MRIs from PV maps of three tissue classes: gray matter, white matter, and CSF. Both models employ the same unit-based generator, while the main difference between low-frequency GAN and high-frequency GAN is in discriminator being used. The architecture of all components, including generator, ResNet discriminator, and patch GAN discriminator, is shown on the figure. The training of the models can be split into two stages. In the first stage, PEG-GAN discriminator is being used. A PEG-GAN discriminator is known to be limited in recovering detail on different scales, which allows us to generate synthetic images without high-frequency detail. The training for the low-frequency GAN terminates at the end of the first training stage. In the second training stage, we resume the training with the pre-trained generator and the ResNet discriminator typically used in super-resolution applications. We notice that training again with ResNet discriminator without pre-trained generator leads to poor results. In super-resolution applications, the inputs to super-resolution GANs are low-resolution images and the outputs are synthetic images with high-resolution detail. In our case, the resolution of the input and the output MRIs remains the same, but the input MRIs generated by the pre-trained generator visually resemble low-resolution images, which allows further recovery of high-frequency detail during the second training stage. That's how we train the high-frequency GAN. We used 1000 T1 weighted brain MRI scans from ADNI dataset for training, validation and testing of both MRI synthesis and segmentation models. The subset of 1000 MRIs was split into training, validation and testing set in the 60-20-20 ratio without any overlaps within the sets. For the segmentation model training, 250 out of 600 images from training sets were randomly selected. All brain MRI scans were pre-processed using bias fill correction in the brain MRI region only, rigid registration to MNI space with the output image dimension of 181 × 217 × 181 voxels, and Z-score intensity normalization. The corresponding labels were derived by segmentation method implemented based on expectation maximization algorithm and further partial volume estimation. The references to the used algorithms can be found in our paper. Regarding the training of generative adversarial networks, we used Atom Optimizer, learning rate decay of 2 × 10⁻⁻⁶ after 20th epoch in the second training stage that correspond to the high-frequency GAN training. Our stopping criteria for both GANs was when generated loss fluctuations were less than 0.01 for at least 10 epochs. For the segmentation task we used Vox2Vox, a GAN-based segmentation network which we adopted to facilitate the segmentation of 4 classes: gray matter, white matter, CSF and background. To evaluate the synthetic scan quality of both models, low frequency and high frequency GAN, we reconstructed low frequency and high frequency synthetic MRIs from PV maps and measured their image quality in relation to the corresponding real MRIs. The PV maps used for the MRI synthesis were derived from real MRI scans included in the test set that consists of 200 samples. For the evaluation, we used full reference image quality metrics: multiscale structural similarity index, normalized root mean square error, and peak signal to noise ratio. We also computed normalized root mean square error between PV maps derived from real and both types of synthetic MRIs. According to the observed results displayed in the tables on the slide, high-frequency MRIs and corresponding PV maps have higher similarity with real MRIs and their PV maps compared to the low-frequency MRI scans. The similarity between synthetic high-frequency MRIs and real MRIs is particularly prominent in measured multiscale structural similarity index and peak signal-to-noise ratio. The asterisks in the tables denote statistically significant results according to t-test after Holm-Bonferroni corrections. The displayed figure represents real, synthetic low frequency and synthetic high frequency brain MRI in the first row, respectively, and the corresponding Fourier domain representations in the second row. The computed image quality metrics numerically support a higher visual similarity between high-frequency synthetic and real MRIs compared to the low-frequency synthetic MRIs in both MRI and Fourier domains. Due to the zoom video resolution, the differences between presented images may not be that obvious. Therefore, I would like to refer you to the figure number 3 in our paper. To evaluate the impact of high-frequency detail on brain segmentation, we trained 15 models with the data split displayed in the table on the slide. 5 models were trained on 50, 100, 150, 200 and 250 real MRIs only. 8 models were trained on 50 real and 50, 100, 150 and 200 synthetic MRIs, either high-frequency or low-frequency synthetic MRIs. The remaining 2 models were trained on 250 real and 200 low-frequency and high-frequency synthetic MRIs. According to results presented on the slide, both low-frequency and high-frequency MRIs improve segmentation model performance for all 3 tissue classes. It is also evident that segmentation models trained with MRIs generated by our augmentation method can achieve comparable performance of models trained on real MRIs only, with only 20% of real samples. Overall segmentation performance of models trained on real and high-frequency synthetic MRIs perform better than models trained on real and low-frequency synthetic MRIs. The largest die-score improvement on models trained on high frequency compared to the low frequency dataset in the gray matter region of interest is up to 1.73%, white matter up to 1.34%, and CSF up to 4.41%. We also visualized the average absolute error computed on the test results of 200 samples for segmentation models trained on 250 real MRIs and combination of 250 real and 200 either low frequency or high frequency synthetic MRIs. The error visualization shows that the model trained on the combination of real MRIs and high-frequency synthetic MRIs improves the segmentation in gray matter and white matter region of interest, comparing to the model training or real MRIs only. That is not the case when it comes to CSF. Nevertheless, even in the CSF region of interest, the model trained on the combination of real MRIs and high-frequency synthetic MRIs performs better than the model trained on combination of real MRIs and low-frequency synthetic MRIs. This visualization was not included in the paper due to the page limit. In summary, we proposed a simple yet effective method for synthetic brain MRI generation with high-frequency detail. According to the observed results, real scans can be replaced with synthetic while achieving comparable results. The die-score results were significantly improved for up to 1.73% for gray matter, 1.34% for white matter, and 4.41% for CSF. Thank you for your attention. I'm happy to answer your questions in the Q&A session after this presentation. Please send me any further inquiries on philip.rusak@csro.au. Thank you.